Hi, everyone, and welcome to today's Ask the Expert webinar. My name is Tina Sindher. Today, we'll be tackling a question that many parents are asking right now: Neffy versus auto-injectors. Which one should you trust in an emergency? For any parent with a child dealing with allergies, knowing the right emergency treatment could be life-changing. So, whether you're a parent, caregiver, or someone living with severe allergies yourself, this conversation is one you won't want to miss. Joining me today is an incredible guest, Brent Anderson. He's the lead investigational drug pharmacist at the Sean and Parker Center for Allergy and Asthma Research. So, Brent, can you start by telling us who you are and what you do?
Of course. So as you mentioned, I'm one of the pharmacists at the Sean and Parker Center. Been here for over 5 years now. So mainly I handle all the day-to-day operations, all the storage, accountability, and dispensation of all of our investigational drug products. I also collaborate on everything related to our research. So this includes investigating new drugs to study, designing protocols, and then towards the end, more manuscript writing, editing, preparing slide decks for presentations. Also have retail management experience where I was able to learn a lot about the insurance side of medications. And that really helps out, particularly for branded medications that don't have cheaper generic alternatives.
Well, thank you so much, Brent, for taking the time to do this. Now, I know that many of our listeners have probably used or at least heard of epinephrine auto-injectors and may have questions about a newer epinephrine delivery option, such as the Neffy nasal spray. I have been asked by many of my patients and research participants about how they compare, which one's easier to use, or which will work best in a stressful emergency. So we're going to go through all of that today. So let's get started. Um, Brent, can you explain what Neffy is and how it works?
Yeah, of course. So as you mentioned, Neffy contains epinephrine. Epinephrine is used as an emergency treatment for type 1 allergic reactions, including anaphylaxis. So this will be your food allergy, which is what we deal with a lot here at the center, drug medication allergies, also insect stings, things like that. And when you have one of these hypersensitivity reactions, some common symptoms are your blood pressure tanks, you may have wheezing, difficulty breathing, you may get hives or a rash, and epinephrine will bind different receptors to reduce or resolve symptoms quickly. It's really a great drug and it's life-saving in many cases. So the difference really here is that Neffy comes as a nasal spray. So no needles, which is great, especially for those with needle anxiety or phobias. But it's approved for 66 pounds and up at this stage. So no new treatments for little ones just yet. It comes as a 2-pack, just like your traditional auto injectors. And each device contains one dose, and each dose is 2 milligrams. So that's a lot higher than you would see in an auto injector, which for adults is 0.3 milligrams. But that's just the difference in nasal versus injection into the intramuscular tissue. So the device itself that looks like that has been approved for several different indications currently being used. It's reliable. You obviously need it to work when you need it. And this also contains intravale technology, which is used in 3 other nasal sprays currently. And basically what that does is it temporarily loosens the space between the nasal cells to increase absorption.
Thank you so much for going through all those details. And I know many of our food allergic families are very excited by the option of having a needle-free strategy to treat an allergic reaction. As you mentioned for our individuals with some needle phobia or worry about that. And then and you went through some of the formulation and the technology behind this. But would you mind sharing with us a little more about how do we know that Neffy works? And does it work just as well as epinephrine auto injections?
Yeah, of course. So because it's so new and based on the way it was studied before approval, we don't know if it's an exact equivalent of an auto injector. But I can tell you what we do know. And it was approved based on 4 separate studies with a total of 175 healthy adults. And it's important to note that These adults were not undergoing an allergic reaction. They did not have anaphylaxis. While you'd like to, study this in the conditions that you're going to use it in the real world, there's ethical and practical limitations to doing this. But what they ended up doing was they looked at epinephrine concentrations in the blood, as well as things like heart rate and blood pressure to see how they compared between a dose of Neffy and a dose of the traditional auto-injector dose. And basically what they found was that they were very, very similar. They're about the same in terms of concentrations of epinephrine in your blood, as well as increases in heart rate and blood pressure. And, that's great news. And also, they repeated the study in children weighing more than 66 pounds and had very similar results to the adults. So, while it looks promising, we would like to see a little more real world data for a little more confidence in using it. The only study I've seen published on this one is a small study in pediatric patients. So at our clinic, we do a lot of food challenges, whether that's to determine if you have an allergy to something or how well treatment did and how much, peanut, for example, you can eat now. And what they looked at was 15 different pediatric patients aged 6 to 17. And they also brought in a 1 milligram dose for those who weigh 33 to 65 pounds versus the 2 milligram dose for 66 pounds and up. And they found that with one dose of the Neffy during at least a grade 2 reaction to their food, that they all resolved within an average of 16 minutes, a median time, and that nobody needed a second dose within 15 minutes of the first. However, there was one patient who did have a biphasic reaction 2 hours and 45 minutes after the first one resolved, meaning their symptoms resolved, and then all of a sudden they had a second wave of symptoms.
And when you say grade 2 reactions, is that a way of describing the severity of the reactions?
Yes, yeah, exactly. So they use their own different scale. There's quite a few different scales, but generally it's grade 1, 2, 3, 4, maybe a 5, depending on the scale. And the higher up you go, the worse your reaction is objectively.
Okay, got it. Well, thank you so much for sharing all the data. And as exciting as this novel technology is, it still sounds like we need more data to better understand how it's going to impact our patients who are in the midst of an allergic reaction or anaphylaxis. One question that comes up from my patients, and I'd love to hear you describe it in more detail, is how do you administer it? Is it the same as using nasal sprays for allergies?
Yeah, so yes and no. First things first, at the first sign of allergic reaction, you need to use it. So use it right away. You can be in any position, so sitting, lying down, standing. Um, but one difference here is that you don't want to do a test spray or a prime spray. It's ready for use. So don't mess around with it. Keep it in the blister packaging or a carrying case so you don't automatically set it off. But you'll just hold it like that. And then you'll put your finger down in the plunger here. I'm left-handed, so I'm going to use my left hand for my left nostril. And then you just insert it into your nostril until your fingers touch your nose. And then you just press it down. And you're done. You do not want to sniff during or after. Just go ahead and continue to breathe normally. If symptoms don't improve or they worsen, you can administer a second dose, but make sure to wait at least 5 minutes. And it's important to know, do it in the same nostril. So it tends to work a little bit better. Don't go from left to right or right to left. Go left, left, or right, right. If you think you'll need another dose, don't administer it. Make sure you get medical treatment right away. And then make sure and dispose of it in the trash so that you don't accidentally use an empty container.
Well, thank you so much, Ren, for going through the process of how to use the medication. What are the most common side effects that one would expect with this new medication?
Yeah, so at the end of the day, it's still epinephrine. You're going to have about the same levels of blood concentration. So you'll get all the side effects associated with administering adrenaline, which would be jitteriness, tremor, headache, upset stomach, sweating, etc. But you'll also get unique route of administration side effects. So with epinephrine, you'll get injection site pain, swelling, redness. With the Neffy, it'll all be nasal related. So most commonly, throat irritation, could be congestion or runny nose, could be tingling of the nasal passage, sneezing, things along those lines. Again, we'll like to see some real world data just because you never know if something unexpected will come up when we get the large population data in. But overall, it looks pretty mild to moderate side effects, and they do resolve fairly quickly.
Is there anyone who we should advise not to use this medication? Is it contraindicated in any individuals?
No, epinephrine in general does have some precautions with things like cardiovascular disease. But by and large, it's a life saving medication, so generally the benefits outweigh the risks. There's no direct contraindication or no explicit one. But the weight would be one. You need to be at least 66 pounds, hopefully 33 for the 1 milligram dose if it gets approved. Also, you do need it to absorb in your nasal passages. So if you have any nasal structural or anatomical issues like polyps, prior broken nose, previous surgery, you may want to stick with the injectable. You also want to probably stick with the injectable if you use other nasal sprays, because I mentioned that intravale technology, which is going to increase absorption of the epinephrine. And the problem is it's going to increase absorption of your other nasal medications and sprays too. And this altered nasal mucosa can last for up to 2 weeks. So it may lead to unwanted side effects and super therapeutic doses of certain medications. But outside of that, it's really just patient preference, comfort, um, coverage, insurance coverage.
Thank you. And I do have a insurance coverage question for you shortly. But before that, I wanted to touch upon, you mentioning how if you have other nasal sprays. So what about patients who have a cold or nasal congestion or are stuffy? Is that ever a contraindication for using Neffy?
Yeah, that's a really good question and important because me, like others, I feel like I've had a cold all winter long. So I need to be able to use my medication. And, I would prefer a nasal spray to an injection personally. So thankfully they looked at it. So they they enrolled patients that had upper respiratory tract infections and they gave a dose of Neffy. And then they had them come back later once their symptoms resolved and gave them another dose, looked at the two, and basically found no differences between the two. Um, in another study, they gave people nasal allergen challenges to induce allergic rhinitis. So basically, would apply some sort of allergen to their nasal cavity, and then they would get the congestion, the swelling of the nasal passages. And then, there were a few small caveats, but by and large, it looked like it worked perfectly fine in these scenarios. But again, they're not having an anaphylactic reaction right then and there. So we'll see how it plays out.
Well, thank you so much for answering that question. Um, and are there any special storage or handling requirements for this drug?
Yeah. So what I want to mention and didn't mention earlier. So it comes as a 2 pack, and you always want to have two devices on hand in case you need to give that second dose. So if you were to, take one dose, your symptoms resolve, you're left with one, you're going to want to go out and get another 2 pack just to make sure to have at least two on hand. Um, but it comes in blister packaging. You could certainly leave it in there so you don't, and just wait to open it until you need to use it. You can also get a carrying case from Neffy's website, neffy.com. It's pretty nice. It's compact. It holds two different devices. And has a QR code with a video how to use it in case you're panicked. And as far as how you want to store it, room temperature is always best. But this one does have a little bit of flexibility versus the auto injector. So they did test it and found it was fine to be up to 122 degrees Fahrenheit, which is quite warm for a few days. And also, it freezes at about 5 degrees Fahrenheit. So just don't get it below 5 degrees because if it's frozen, it's not going to work. It won't deliver your epinephrine. And if you compare that to the auto injectors, you're looking at more, 59 to 86 degrees Fahrenheit. So a little more flexibility for carrying it with you and not having it go bad. And then the last thing is the shelf life. So for the shelf life, it's 30 months after manufacturer date. Um, so you won't have to replace it as often as an auto injector, which is more like 18 months if you don't end up using it.
Thank you so much, Brent. So it sounds like it has longer shelf life and is a little more forgiving in terms of temperature excursion. So
Yeah.
in the middle of a heat wave, if it's stuck in your car, um, you wouldn't have to worry about it as much during travel or things like that. So that's great. What have you heard in terms of um, insurance coverage and the cost of a Neffy?
Okay. So your insurance could just outright cover it, or there's a manufacturer copay savings program to pay as little as $25. So if your copay is, say, $100, you can run this copay card along with your commercial non-government insurance. It doesn't need to be commercial and non-government, and then you pay $25. I think the maximum benefit for that is around $200. So if it's not covered, it's still going to be expensive. So if you don't qualify for that card or insurance doesn't cover it, you could get it through a Good RX discount card or the online pharmacy Blink RX for $199 for the 2-pack. So still a little expensive, but not as bad as some of the other prices we've seen. And there also is a patient assistance program. So you can check that out on their website if you want to see if you can qualify.
Thank you for that. So Brent, in an emergency, which device is easier to use or for a caregiver to administer?
Honestly, I think both are designed for ease of use. I don't think one necessarily is easier or harder. When it comes to the auto injector, there's always the risk for a needle related injury. So that's, out of the question with the nasal spray. But you do have to have nice proper form to use this because you don't want the medication to drip out or you're not going to get the proper dose. So it's really just comes down to proper training, proper technique and what you're comfortable using with an emergency. So just make sure to be prepared.
And then speaking of proper training, does the Neffy come with the trainer that patients can learn on?
It does not, but again, that's something you can order on their website.
Thank you for that. And I believe 2 points actually. One is that the company is testing for a device and formulation for younger children less than 66 pounds. Is that right?
That's right. So they're waiting on the decision from the FDA. It should come out within a month, so stay tuned for
Oh,
that.
wonderful.
But it's looking like it'll be a 1 milligram dose for 33 to 65 pounds, which
Hmm.
lines up with the original epinephrine dosing guidelines.
And then I believe the company is currently undergoing kind of real world testing. Is that right? In terms of clinics where they are doing food challenges or other procedures that may result in allergic reactions or anaphylaxis, and then using Neffy to treat it and kind of seeing what the outcomes are. Have you heard the same?
I've heard that they plan on doing it. I don't know if they actively are. I haven't seen anything published on it quite yet. Outside of that study in Japan, I just talked about.
Okay. Okay. Well, thank you so much for going through all that. It's very, as you've highlighted, very promising, but we still need more data to understand how it's going to work for our families and our kids. Now for some rapid fire questions, and these are based on some frequently asked questions that we get from patients and families and caregivers. So here's one. Is there a bad smell or taste? What can the patient expect?
Yeah, so I personally have not used it. My device just contains air, but per their press release, there's not a bad smell or taste. Although among listed side effects would be numbness in the mouth and potentially pain in the gums or teeth. I think the incidence of these side effects increases with 2 doses, but it is something just to keep in mind.
Great. Could Neffy be used in someone who may not be awake or is unconscious?
Yeah, that's a great thing about it. As I mentioned, it can be used in any position. So if somebody's unconscious on the ground, and it requires no inhalation from them, so you absolutely could.
And how fast does Neffy kick in? Does it work as quickly as an epinephrine autoinjector?
Yeah, so per their preliminary studies, it worked within minutes and just followed the exact same profile as an epinephrine auto-injector did.
And is it easy to use for an older child or teenager themselves, or is it better to have an adult administer it?
Again, it comes down to training, but yeah, I mean, I think a lot of teenagers probably would prefer not to inject themselves. So as long as they're 66 pounds and they've demonstrated the ability to use a nasal spray, have them practice to show you they know how to use it. Yeah, absolutely. Go ahead.
And then, do you have any advice for food allergy patients and caregivers who may be hesitant to try a new treatment like Neffy?
Yeah, I think it's completely understandable, especially with the trials being in these healthy adults. So what I would say is if you're comfortable using an auto injector, if you are good about keeping one that's non-expired and you're willing to use it when you need to, then I think it's perfectly reasonable to keep doing that until we get a little more data and then we can reassess.
And thank you for going through all of this information and diving into the research. So, based on what you know now, do you have a favorite, like an epinephrine autoinjector or Neffy nasal spray?
Not necessarily. So I think Neffy shows a tremendous amount of promise with some limitations in how they needed to study it. And I think with it being so new, it's going to take some time to get this population health data in and see if there's any unforeseen side effects or, issues with blood pressure going too high or anything along those lines. Um, but I would say, there's stats from a recent survey that I saw where only one third of adults with food allergy have an unexpired epinephrine on hand. And that may be not even one that they carry around with them. It could be in their, kitchen when they need it in a restaurant, half an hour from their house. So I think if it, if you're able, if somebody is willing to use the Neffy, I think even without the extra data and less of a track record, having that Neffy on hand is going to be better than no epinephrine at all. Absolutely. One thing I was going to ask you, Dr. Sindher, would be what are your thoughts about having both on hand? So, say a patient already has an EpiPen, but they really, really, really don't want to use it. They'll only use it in the absolute most dire, y- you know, circumstances. What do you think about maybe having them have a Neffy on hand to use right away? And then if it doesn't work or their symptoms, get worse, then going for the auto injector as a failsafe.
That's such a good question, Brent, because that is something we are telling our older patients where there are some folks who are excited to try something new, and we are prescribing them both the Neffy nasal spray and the auto injector. And the guidance I'm telling them is that I too am looking for more data to feel truly um, comfortable thinking that
Yeah,
this will take care of their anaphylaxis until the real world data comes out and more data comes out. I have been telling my patients, like, use your Neffy first, but then if symptoms are not better in 15 minutes, please go ahead and use the injector that
sure.
has been around for a very long time and has been shown to work.
Yeah, I thought that was a good idea. And it wasn't studied that way per se. So make sure you get your doctor's blessing to do so. But I think that's a fine option as well.
Well, thank you so much, Brent, for coming today and sharing your wisdom, your knowledge, your expertise, and your time. So, to summarize our conversation, we discussed the important aspects of both Neffy and auto-injectors and data on Neffy's efficacy, administration, potential side effects, and thank you for providing insights into patient preference and consideration when thinking about new treatment strategies. And at the end of the day, I think for all of us, the ultimate goal is to empower our food allergic or, those suffering from allergies, but those at risk for anaphylaxis, to empower them with the knowledge to handle allergic emergencies confidently.
Yeah, well, thank you for having me, Dr. Sindher. And I just wanted to close with, if you need it, please use it. It could really save you.
We had a research participant who was an artist, and he designed an EpiPen with a cape like a superhero and with the logo, "Have no fear, Epi is here." That's kind of what I'm imagining as we talk about epinephrine.
That's right.
And great. Okay, we've covered a lot of ground today. Whether you're trying to choose between Neffy and an auto-injector, concerned about your child's comfort, or wondering about which one will work best, this is all about giving you the information you need to make a choice that's right for your family. Stay safe, take care, and remember, it's all about being prepared with your medication for any emergency. Have a great day.